Good morning and welcome to another live Q&A. My name is Talon Ellithorpe. I'm the practice manager at Tustin Longevity Center. We're an integrative preventative functional medicine clinic in Tustin, California. And today we are going to be doing a live Q&A. We're looking forward to your comments. We're going to be monitoring those and answering those on the spot. Any questions that you have about health or disease or prevention. Current topics, obviously, in current news are coronavirus, COVID-19. And I'm joined here with our medical director, Dr. Rita Ellithorpe, and we'll be answering your questions live. So we look forward to those again in the chat section. And we'll be answering those here for you. And do us a favor, if you're finding these videos valuable, we certainly don't think that there's enough information out there about prevention, what you can do to keep you and your family and your loved ones safe and healthy. So if you can spread the word, share these videos with your friends and family, people that you care about. And a big help would be if you subscribe to our channel. We're looking for subscriptions so that we can keep you updated. That's the best way to keep you informed and to help us sort of grow our reach with the people that we're speaking to.
And press the like button.
Yes, and like the video if this information is speaking to you. So with that being said, I'll have Dr. Ellithorpe kick us off with a little bit of news, and then we'll get right into your questions. So we are looking for those. Doctor, what do you have for us today?
Well, over the course of the week, I'm constantly looking in the literature, looking at history, looking at the way mankind has always dealt with these things. And I want to bring to the forefront, although we have concerns about the COVID-19 virus, I want to bring up some statistics from the Centers for Disease Control. And I just printed this off last night. I won't tell you how late, because then I would have to admit I stayed up too late last night and didn't get my sleep for my immune system. But heart disease. Heart disease in the United States is the leading cause of death in both women, not breast cancer, women and men. And one person dies every 37 seconds. Now I think it's actually up to every 34 seconds. One person dies every 34 seconds in the United States from heart disease. And that's getting up to about 650 to as much as sometimes nearing 800,000 deaths per year of Americans, and that's roughly 1 in 3 deaths. So heart disease is the #1 killer. Can you imagine every 34 seconds someone is dying from heart disease? And about a third of those are premature deaths. That's the 30-year-old who was running and died, the basketball player. There's too many premature cardiovascular deaths. And needless to say, the cost of heart deaths in the United States is well into $350 billion per year. Can you imagine if we had something that could reduce the death rate from cardiovascular disease? And I want to remind you, we do. We have EDTA chelation therapy. The TAC trial to assess chelation therapy, was done between 2002 and 2012, over 10 years. The study looked at everyone who had a heart attack. They were all managed by the standard cardiology protocol for post-heart attack. They were on statins. They were on platelet inhibitors like Plavix or aspirin. They were on beta blockers. They were on ACE inhibitors. And they were all followed for 5 years, and it was blinded to the doctor and the patient. And they were either given, a group was given the chelation with the high-dose wonderful antioxidant vitamin minerals. Another group was just given the chelation with a placebo vitamin. Another group was given just the vitamins with a fake IV. And the last group was given both a fake placebo vitamin and a fake placebo IV. So there were really 4 groups. So we could actually identify that we, with especially the diabetics, were able to see well into the 40, almost up to 50% reduction in cardiovascular events, deaths, strokes, another clot, another heart attack. We were able to do that much prevention.
That's significant, right? If we had a drug that made that big of an outcome,
There is no drug that can approach that. In fact, the number needed to treat is a number that we look for in research, saying if you had, 100 people and you gave a drug for the correct diagnosis in all those 100 people, how many people would have to use the drug before we could really expect to see a improvement? And that number needed to treat, for instance, for statins, I believe is 32. So you give out statins left and right, but only every 32nd patient is going to see a beneficial outcome from that. You look at aspirin, I think that's 1 in 28. But you look at the number here, the number needed to treat in this group was 6. So there is no drug, there is none that can compete with EDTA chelation therapy, working through well-established pathways, nitric oxide to open up the capillaries, improve the blood flow, get that gangrene toe from diabetes saved instead of cutting it off. And we now have tech trial 2. They saw such magnificent improvement, especially in diabetics and those with peripheral vascular disease. They created a tech trial 2 that started in 2016, looking at just diabetics because they have much more cardiovascular disease. But about 33% of the U.S. population is now becoming diabetic or pre-diabetic. So if heart disease is our number 1 killer, and approximately a third of the U.S. population is becoming diabetic, and diabetes has the major consequence of premature cardiovascular problems, don't you think we should be also talking about known events? And remember, EDTA is FDA approved, and it is used off-label for our helping with the microcirculation in the human body from head to toe. Why aren't we addressing this for the sake of the 1 in every 34-second deaths of heart disease? Why aren't we calling up our congressmen, our senators, our legislatures and saying, why is not this wonderful 70-year-old FDA-approved drug, EDTA, ethylene diamine tetracetic acid, that has a safety record that is unapproachable? They can only identify in the past, say, 20 years in research about 3 or 4 deaths, and that was from a mistaken administration of it, compared to the millions of treatments that are given every year. So I want to start this off by giving us a context. Heart disease, EDTA chelation, and by the way, if we gave EDTA chelation to all intensive care and hospitalized patients, we would improve the microcirculation to their lungs, so when they took in a deep breath or on the respirator, they would have better oxygenation, and that increased capillary flow would remove the inflammatory debris of the disease of the COVID virus destruction. And I would also give them a vitamin C with it as well. So let's bear this in mind as well.
And I'm starting to get questions, and so you let me know when we can ask those.
All right, well, let me just give you the flu season burden. It came out in the CDC for 2019 to 2020, and here are the CDC stats for this year's flu that we're just coming out of. And they're saying for the flu, the influenza that comes every year, 39 million to 55 million were hit with the flu this year. Between 18 million and 26 million doctor visits occurred from the flu this year. There were 400,000 to 730,000 hospitalizations due to flu in America this year. And they estimate there were 24,000 to 63,000 flu deaths for this flu season.
And this is just in the United States?
Just in the United States.
Okay, so that gives us a little bit of context. Excuse us. So we did get our first question in here. What should autoimmune compromised people be doing to strengthen their immune system against the virus?
Autoimmune disease is a general category that speaks to inflammation. whether it is attacking your thyroid and inflaming the thyroid, causing an itis like thyroiditis, or if you had inflamed joints, having rheumatitis, or if it's causing a skin disorder like psoriasis. So all the autoimmune diseases in general are an inflammatory disease.
Okay.
So the best thing to do to decrease inflammation is to drink water. Half your weight in ounces every day. Water will help reduce the inflammation. It will help mobilize your immune system that is trying to remove the injured, debris cells. If you took enzymes, the older you get, the less enzymes you produce naturally compared to when you were younger. So we use Vitalzyme here, we use Vascuzyme here, we use Proteozyme here. These are systemic enzymes that work as anti-inflammatory to clear away that debris. And that debris alarms your immune system. And so if you can clean it away and rinse it away, your immune system is better focused on a bacteria or a virus or a fungus coming at you. If you took vitamin D, of course vitamin D, you have receptors on all your cells for vitamin D, that would enhance your innate immune defense system. If you got a good night's sleep, that would help you. If you did and came here to a doctor that is a functional doctor, a test such as the immunofood allergy test, because most of these are gut-mediated problems and most of your immune system is lining your gut. So if you reduced your food allergies or ate a more simplistic daily diet and not so much variety or wide spices, if you got your sugar content down, you wouldn't be clogging up all the capillaries. And so these are just some general things that you could do, and I would certainly recommend at least 2 nutrients. One would be our TLC Energy Core that has a plethora of micronutrients that are in it with clinical studies as well as our own clinical studies that help your liver to detox this material out of you, that has some D, that has some C, that has the B vitamins, but it has minerals such as zinc in it, and zinc is so important in fighting viral infections. The second nutrient I would mention outside of the vitamin D I already mentioned, and TLC Energy Core or MitoCore, would be the Juice Plus series. The Juice Plus series has been studied in smokers with chronic injury to their lung, the elderly, the stressed person. There are multiple studies showing the immune enhancement, the better white blood cell count differentials, and some of the cytokines that are known to fight off these illnesses. That's well established. Plus we have 3 million children roughly in the Family Health Children Study showing the better immune system where they had less colds, less days missed from school, less doctor visits, less prescription medicine, less over-the-counter medicines used. So there is no doubt the most researched nutraceutical out there for your immune system to date would be the Juice Plus. So I would take that, I would take D, I would take TLC, MitoCore, Energy Core, and enzymes. That's what I would do.
Great answer. Okay, no other questions yet. We are looking for them, so go ahead and post those in the chat section, and we'll answer those as they come. Doctor, what else did you study up on late last night?
Well, you're hearing a lot of discussion. It's as if the only thing on the planet that can help us are vaccines. And I have questions. If we look at their conversation regarding hydroxychloroquine, or even the value of azithromycin or erythromycin, the macrolide groups, and I talked about that in January already when this first opened, how to get zinc inside of your cells. Why don't they ask how, if they want, such controlled studies with hydroxychloroquine, like they're worried about its safety, they want blinded controlled studies, they want a good number, maybe 1,000 in one group gets it, 1,000 in one group does not get it.
I heard on NPR yesterday morning the doctor talking about this, saying we really need hundreds of thousands of patients in a study before this should be approved.
So I would ask them, they ask about controlled trials for hydroxychloroquine because they have concerns, but why don't they demand that for vaccines? So they're up there on the podium talking to you every day about, and the vaccine is being developed, and the vaccine is being developed, and we want clinical trials. And but I tell you that I'm going to bring to you and read to you one paragraph of the National Academies for Sciences, Engineering, and Medicine. And on this publication, it is a review that was done concerning the childhood immunization schedule and safety, stakeholder concerns, science evidence, and future studies. And this was, there's a body of people pushing for a review of the safety of vaccines. This was done in 2013, 7 years ago. And this was published by the Institutes of Medicine. So I'm going to go to the summary on page 5. And I want to tell you about their conclusions. No study has directly examined health outcomes and stakeholder concerns in precisely the way that the committee was charged to address in its statement of task, meaning they were given the charge to look at safety. No studies have compared the differences in health outcomes that some stakeholders questioned between entirely unimmunized populations of children and fully immunized children. Experts who addressed the committee pointed not to a body of evidence that had been overlooked, but rather to the fact that existing research has not been designed to test the entire immunization schedule. The committee believes that although the available evidence is reassuring, studies designed to examine the long-term effects of the cumulative number of vaccines or other aspects of the immunization schedules have not been conducted.
So sum that up for us. What does that mean to you?
It means no studies on the administration of vaccines in the United States on its population and children has ever been properly conducted. Now, in 1986, the National Childhood Vaccine Injury Act in 1986 was signed. That is the National Childhood Vaccine Injury Act. It's the Injury Act from vaccines. It means that they admitted in 1986 and brought legislation up to look at the injury impact of vaccines. And in that legislation, it is required by the Human Health Services to do and conduct studies that prove in their studies the safety and efficacy value of these vaccines being generated. However, this law gave protection to all pharmaceutical industries from any liability from injury. So here you have a body of pharmacy producers of vaccine who have no liability for you to sue them if you injure them. This is an act that identifies trying to protect children from vaccine injuries, with the mandate that every 2 years they're supposed to present to Congress the safety and efficacy it makes a difference to the vaccine, and this has never been done. So if it's never been done, and then they did a review in 2013 at the Institutes of Medicine, because there are people who have questions like I do, and they say that the studies designed to examine the long-term effects of the cumulative number of vaccines or other aspects of the immunization schedule have not been conducted. So if you're up there telling me vaccines are the solution, we got to develop a vaccine, and you can't show me since 1986, since a law was enacted to protect the children, that they never did the studies to prove that they're protecting them, and the companies are still protected from liability, I don't trust the system.
Okay, we've got a couple questions that have come in. Thank you for that info, doctor. First one is, we're currently taking 2 capsules, I assume, of the Viracid each day. Is it okay to also take one 18.75 milligram zinc lozenge every day?
Yes, it is. I believe there's something like 20 some milligrams in the Viracid if you take 2 a day. I don't have it right on the top of my head. I have the bottle near me. But high-dose zinc would be somewhere in the realms of anything 50 to 100 milligrams a day. And we talk about this because there is a balance between the minerals and their jobs within the system of the body. If you took high-dose zinc for, let's say, a month, 50 to 100 milligrams, and again, you see, this is where we need study money and grant money to go. We would know that copper to zinc ratio can be off a bit, and both of them are essential. The ratio is about 7 to 1 zinc to copper, 10 to 1 zinc to copper, but do not stress over these small milligram ranges over a short range, and small milligram ranges is really anything under 50.
Okay, good answer. And I just got word that we got a great big shipment in of reacted zinc. That's the chelated, very bioavailable.
Right.
And we also have the Zinzyme Forte back in stock as well too.
That's
25 milligrams.
That's awesome. Zinc, remember, the action of hydroxychloroquine is to get through the cell membrane wall and help bring zinc inside to the cell where it can stop the replication of the virus. Why aren't we hearing more talk about this? And let's get research into the nutraceutical world. Let's get billions of dollars into doctors like myself and all that have been painstakingly using our own money in our pockets, living a more humble lifestyle, paying for this kind of research with ourselves and our patients here, and doing what publications we can do.
Keeping people healthy.
Yeah.
Next question is there a way to detox from recently given vaccines, or even to detox from previously given vaccines?
That would point to mostly the heavy metals that are used as adjuvants. Remember, a vaccine essentially is a very foreign way to introduce to you to a pathogen. Normally it's through our mouth and our gut, cuts and wounds. But they inject this into the muscle in a very foreign place that it would never normally be injected. And the body is very smart, and it kind of says that's weird and doesn't get too excited. So in order to amplify the reaction to that shot, they put in adjuvants. Some of that is aluminum, SV40, the many different things that are irritating and alarming to the immune system, so it'll make the immune system come to that site and then find out and create this massive cytokine reaction, hopefully then to produce antibodies, and you have some kind of immunity to this. Now, I want to point out that these are not forever immune, because it's an abnormal way to find this in your body. This lifelong immunity that, for instance, I probably have to measles because I had it as a child. My lifelong immunity to chicken pox is because I had it as a child. But these immune stimulants through the MMR, we find that the immune fades in these people, and that they will have to have another shot over time. And that's like in Disneyland, they found the people who created that measles outbreak around Disneyland, these have been in previously immunized, vaccinated people. So there was a large portion of that confounding the understanding of the value of the vaccine.
Okay, so to detox from that, to get back to that question, I'm assuming you
that's right.
chelation.
Yes, EDTA chelation will nicely remove the aluminum, and these adjuvants we put in high-dose vitamin C. Vitamin C is a nice antioxidant that helps get rid of volatile organic acid, PCBs, things like this. Enzymes helps a detox from this. A low-carb diet promotes detoxing. Getting a good night's sleep helps promote Exercise helps promote detoxing, if I didn't say that.
And Maria, you mentioned previous vaccines and detoxing from those. Our body does not do a very good job it doesn't have a process to get rid of heavy metals. So we store those and they're just in there for
Right.
long periods of time. So really, the only way to get rid of that effectively is using something like EDTA chelation to reach in there, chelate or grab onto it and pull it out.
The other components are organic, meaning your immune system and your enzymes should be chewing up those particles that were foreign to you and isolating them. But taking extrasystemic enzymes, taking N-acetylcysteine, taking high-dose vitamin C, intravenously, EDTA chelation with enzymes, this whole thing is a cleansing, and drink enough water, and then move your body in a rhythmic, like washing machine effect,
Okay. Next question is, if you're already taking the ZPak for a bronchial infection, are you more susceptible to get the virus? If so, what can you do to protect yourself?
No, ZPak, if anything, would help you resist the virus better, because ZPak, azithromycin, is a macrolide. Macrolides help bring zinc into the cell to fight viruses. So you're actually better protected.
Okay, but we might wipe out some of the good probiotics, right?
Yes, I'm presuming, I'm talking to my patient base. I have all my patients, all our doctors here give a probiotic, especially during times when you're on antibiotics. We'll often give you an additional dosing of probiotics for that month as well, to kind of recover from the damage of the antibiotics.
If you get this, can you get it again? Or pass it to others when you are better?
If you get the virus, this is being studied. We don't have the answer right now. Yeah. I would say that if you picked it up from the casual human-to-human passage, you're getting it in the natural aerosolized form, and your immune system is identifying it, making antibodies, and this is your best protection. They're already talking about, casually at least, the healthcare workers that are getting these antibody studies done are more comfortable coming to work because they've already mounted an immune system against the virus. So I'm going to lean on the side of history, and history says once you've been exposed to a virus, you build those antibodies up, you're more resistant and far less likely to succumb again.
Okay, good question. Next one is, just prescribe gabapentin for neuropathy. Don't take prescription drugs and concerned. Can you tell me anything about this drug? Also, can I take ibuprofen for pain with this?
Yeah, gabapentin helps on the nerve, the brain receptor sites for stimulation. It reduces the excitability of these signals. So it's basically a natural amino acid kind of creation to kind of calm these things. I'm not worried about gabapentin and side effects, and if this helps you. And the other thing is, they were doing what?
Ibuprofen?
Yeah, ibuprofen. Ibuprofen is a natural, rather a non-natural anti-inflammatory. It's a non-steroidal anti-inflammatory. And this works through blocking certain enzyme pathways, COX-2 inhibitor pathways, which are very valuable in producing coenzyme Q10 and for heart health and your other energy of your mitochondria have to have coenzyme Q10. So I'm not in favor of ibuprofen on a prolonged basis. If you're talking about a few days and that's it, and you take it with some food because it can create ulcerations, and we see this higher risk the older you are, then I would not use ibuprofen on a prolonged basis. The other thing I want to point out is water is an anti-inflammatory. Take systemic enzymes that will help inflammation at higher doses. For instance, if I ache, or I'm 66, almost if my back hurts or my knee hurts or something, I will take maybe 10 Vitalzyme twice a day for 3 days. I'll fast. I'll stop eating for a day or 2 or 3 or up to 5 until that pain goes away. Often I'll do a EDTA chelation with vitamin C to improve the microcirculation to wherever my pain is at. So there's many other things you can do. So you need to find why you have a neuropathy. You know, if you look at my YouTube video on the truth about chelation, the neurotoxic effect of lead, cadmium, arsenic, zinc, cadmium, did I say that? Mercury. These are well-known nerve injury elements, as well as vascular damaging. On top of our high-carb diet, our lack of water, our inactive society, no wonder we don't have even more neuropathies. But if you're not addressing your heavy metal load, I guarantee you that you do. The older you are, the higher the risk that ibuprofen will cause bleeding ulcerations. So you have to be careful of that. But you don't have to be worried about that if you're taking natural systemic enzymes on an empty stomach.
Thank you for that answer. Well, I'll tell you what, we are just about out of time. We do this every Wednesday at 9:45 a.m. Pacific Standard Time, or Pacific Time, I should say, until 10:15, right, Blake? 10:15. So we'll be here next Wednesday for another half an hour live Q&A. Subscribe to our YouTube channel. We might end up doing an extra one here or there if something important comes out. You can find us on Facebook, Tustin Longevity Center, where you can ask us your questions there or post comments under this video. We're looking at those, and we'll hopefully have some great questions next week as well too. Doctor, I just want to say thank you so much for getting up here and just taking any question that kind of comes at us. If you don't know, this is my mom, and you never cease to amaze me with your wealth of knowledge and being able to just take these questions on the fly. So
glory to God.
Thank you so much. We appreciate you joining and listening in. Stay safe, stay healthy, take care of your immune system, and we look forward to seeing you with your questions next Wednesday at 9:45 a.m.